It is February 19th. My name is Tressa, and my paper is empty. So I'm going to walk into the patient's room. I'm going to identify myself as your nurse. Hi, my name is Tressa. I'm going to be your nurse today. Can you tell me your name and date of birth?
Douglas Mulder, 6/21/64.
Okay, and it matches up with your wrist bracelet. And I'm just going to ask you a couple questions about your health history, so then we can give you the best care possible. Okay, so I'm going to start with the first question of why you're in here today.
My thumbs hurt me all the time.
Okay, and what makes your thumbs hurt? Have you figured?
When I overwork them.
Okay, and can you?
Cold weather too.
Okay, can you point to where they hurt?
Right here.
Okay.
Right here.
And when they hurt, from a 0 to 10, 10 being the worst, how bad do they hurt?
6.
Okay, and the duration of it. So how long does that usually hurt?
Half day.
Half a day, so like 6 hours?
Yeah.
12 hours? Okay. And so then, how can you characterize this pain? Explain it. Like, dull, achy?
Just kind of between an achy. Yeah, just kind of aches. Kind of hurts. It's there.
Okay. Does it affect your, limitations of your daily activities?
Sometimes I can't grip things very good.
Okay. And do you notice it more when you move them more, or?
Yeah, when I use them a lot.
When you use them a lot. Okay. And have you tried anything to alleviate the pain?
Warm water.
Warm water? Okay, so no medications?
Warm water helps.
Okay, so next thing is, what medications are you on at the moment, prescription-wise?
High blood pressure, Photonics. I don't know what the name of my high blood pressure pill is. Photonics, my belly pill, and a vitamin.
Okay, a vitamin?
Yeah.
Do you know any dosage amounts for any of those?
Okay. I think my blood pressure is like 10.
Okay. Do you take any over-the-counter medication? No. Okay. Or any supplements?
No.
Okay. Do you have any allergies to any medications or foods?
No.
Okay. Now we're going to go into your medical history. So have you been diagnosed with anything or had any recent, surgery-wise?
Recently, how far back?
Just any surgeries. Just tell me.
Yeah, I had a hernia, a hyoid hernia, appendicitis. That was it.
Okay. And then have you ever been diagnosed with anything?
No.
Okay. Have you had any vaccination lately? Tetanus shot?
Well, it's been a while since I had tetanus shot.
Okay. You should probably figure when you should get the next one. Do you wear your seatbelt?
Well, I sure do.
Okay. Any use of tobacco or alcohol products?
No, I haven't done that probably for 30 years.
Okay. Okay, so family history. So I'm going to ask how your grandparents died, how your parents died, and any other close siblings.
The heart stopped.
Oh, obviously. Okay, so grandparents, how did your mom's parents die?
Grandpa smoked, and I think he had blood circulation, poor blood circulation from the cigarettes, and the gangrene set in that foot, and they didn't get that foot and leg cut off quick enough. Gangrene killed him.
Okay.
Grandma had strokes, but that didn't really kill her. But I think it finally comes down to old age on her.
Okay, and what about your dad's parents?
Grandma had something wrong with her belly, inside her belly, because she got the vomiting up nasty stuff.
Okay. And then
Grandpa had Alzheimer's.
Okay, and if any of your parents are living or deceased?
Mom died with rectal cancer.
Okay.
And Dad's still kicking.
Okay, any siblings or children that have died?
Nope, they're all kicking.
Okay. So your personal or social history. Have you ever had any trouble making friends, staying with friends?
No.
Okay.
No.
Are you married?
Oh, yeah.
Okay. So I'm going to go down to the systems now. So I'm going to ask you questions about basically all the systems you could possibly think of. So the first one is general. Have you ever had any weight gain or weight loss recently? No. Okay, any fever?
No.
Fatigue?
No.
Or weakness?
No.
Okay. So your skin, have you had any changes in moles?
No.
Do you wear sunscreen?
No.
You should wear sunscreen.
I know.
Okay. And any rashes?
No.
Lumps?
No.
Bumps?
No.
Okay.
No.
And then changes in your hair or nails?
My hair's turning gray.
Okay, not the old age.
And my nails grow.
Okay. So now the next one is, have you had any recent lots of episodes of headaches?
No.
Okay. Uses of hearing aids or visual aids?
No. Oh, I wear glasses.
Okay. And when you see, do you have any visual disturbances like floaters?
No.
Okay. And when was your last dental exam?
Last what?
Dental exam. You should probably go to
3 or
the
4 years
dentist.
ago.
Okay, go to the dentist. Okay, so your neck. Have you had any swollen glands? Okay. Any stiffness or pain in the neck?
Oh, yeah.
Your wife? Okay, your respiratory system. Do you have a cough? Okay.
Depending on if I get in the dust.
Okay. Have you ever had a TB test?
If I did, it was years when I was a kid.
Okay.
Long
And then, have you ever been diagnosed with pneumonia, bronchitis? Okay. How many? Both of them? Okay. Now we're going to cardiovascular. So, do you have any chest pain? High blood pressure. You said that earlier. And then your past EKGs. Have they been normal? Okay. And then, do you ever notice any swelling in your feet? Okay. Now, your gastrointestinal. Do you have trouble swallowing? Okay. Heartburn? How often is that heartburn? Depends on what you eat.
Yeah.
Okay. And then, do you ever have any rectal bleeding?
Nope.
When was your last colonoscopy?
June.
Okay. And everything was normal with that? Okay. And then, have you noticed any changes in your bowel habits?
Depending on what I eat.
Okay. And then your peripheral vascular. So, do you notice any changes when it gets cold that your fingertips change, like your fingertips get little?
No, they stay pink.
Okay. And then muscle pain when you walk.
If I do a lot of it, yeah. Because if I don't do a lot of walking, yeah, my muscles get sore.
Okay. So urinary. So, do you have ever had a kidney stone? Okay. Did they ever tell you?
2 of them.
2 of them. Okay. And you got rid of those. Okay.
Very painful way.
Okay. Have you ever had any episodes of incontinence?
Uh-uh.
Okay. Frequency in urination.
Once a night.
And dribbling?
Nope.
Okay. And musculoskeletal. So, you told me that your fingers hurt. Do you have ever got diagnosed? Your thumbs hurt, sorry. Do you ever have, like, any arthritis?
Not that I know of.
Or any muscle or other joint pain?
Depending on what I do for the day, I mean, I might have, my back may hurt me, my legs may hurt me, depending on how much work I do and how much I'm on my feet hurt me every night.
Okay, psychiatrically. Have you ever been depressed?
No.
Tried to commit suicide?
No.
Have you been nervous?
No.
Stressed?
No.
Or
Well, yeah, I've been stressed.
Okay.
Kids stress me.
Okay, and then any
School
tension?
stress me.
Tension?
Yeah, when I'm out at the fairgrounds, stuff like that, yeah.
Okay, neurologically wise. Do you have tingling in your fingers?
No.
Okay. Have you ever had fainting spells?
No.
Or dizziness?
No. Okay. Depending on how much I drank then.
Okay.
I have booze.
Hemologic. Hemologic. So do you bruise easily?
No.
And when you cut yourself, do you find yourself bleeding a lot or do you clot pretty fast?
Oh, I heal up pretty good.
Okay.
I heal up quick.
Okay. And then have you ever had anemia or been diagnosed with anemia? So low iron or low hemoglobin?
Yeah, one time I had low iron.
You were anemic?
I was low iron.
Okay. And then have you
But
ever...
that was before I changed my way of living too.
Okay. And then have you ever had a blood transfusion? Okay. And the last one is the endocrine system. So do you sweat excessively?
Oh, I sweat easy.
Okay. Polyuria, is it a lot of your... Do you go to the bathroom frequently?
No.
Are you hungry a lot?
No.
Thirsty a lot?
No.
Okay.
I'm hungry. I get hungry if I work hard, but I get thirsty if I work hard.
Okay, so
I
that
pee a lot
was
if I drink a lot.
that was the end of my questions. I will go let the doctors know any abnormal stuff, and he'll come in here to address your complaint about your thumbs hurting.
Ooh.